There are many reasons why I decided to go into pelvic floor physical therapy, but I guess the number one reason that really made me or set the ball rolling for me was during my first pregnancy and the experience that I went through with the pain and then kind of the reactions and feedback I got from my doctors. Hi, my name is Dr. Sigi Reyes. I'm a pelvic floor physical therapist, pregnancy and postpartum corrective exercise specialist. My story starts back when I was pregnant with my first one. I didn't have too much pain or anything initially right off the bat, but around halfway through my pregnancy, so I remember distinctly around like 18 weeks pregnant, I started to experience some pretty significant pain down the center of my pelvis, which I later learned was symphysis pubis dysfunction. And when I brought this up to my doctor, she kind of brushed me off and told me, there's nothing you can do about it. I'm sorry, this is just what it is. You're pregnant, what do you expect? And I remember leaving the doctor's office kind of disappointed that they didn't have any options for me. They didn't refer me to physical therapy at the time. They didn't, not even like a chiropractor, nothing. So I was just kind of left dealing with it on my own. Now, when you're a PT student, you cover quite a bit of information. It's from like neuro-based physical therapy to outpatient orthopedics. So women's health physical therapy gets maybe a day or two max over the information regarding pelvic floor physical therapy. It's very generic. So it is a very specialized field. And so when I was pregnant with my first one, pelvic floor PT was just beginning to get more of a spotlight on them. And I think through social media, it has definitely gotten more light shed up on it. So people are more aware about what the pelvic floor even is, which is great. But at the time, I didn't have that. So I remember going back to the few notes that I did have, kind of going through that and saying, hey, there's got to be more to this than just the few exercises that they gave me initially. Going forward after delivery, with my first one, I ended up also having quite a wide diastasis recti. And again, didn't really even check for this myself right away because it wasn't something that was bothering me until I started exercising. And at the time, I was doing a high intensity workout where it involved jumping, which didn't notice any pelvic floor issues. But when I would get down and do like crunches or planks, that's when I noticed that bulging down the center. And again, remember thinking like, what is this? What do I do about it? And then kind of going through my notes again and trying to find out as much information as I could. So then I started taking courses specifically towards pelvic floor physical therapy, prenatal exercises, postpartum and delivery, all those things, and really started focusing my time and efforts and continuing education specifically for women's health. So this is the crazy part. Everything that I was learning during these courses, I went ahead and applied it to myself. So I was like my own guinea pig, putting these exercises to the test to see if they really worked, if they were really something that was beneficial. And during my first pregnancy, again, I was experiencing the symphysis pubis pain during around the halfway mark. So it was like 18, 19 weeks along. And typically what happens is once you have that symphysis pubis in other pregnancies, you're going to experience it sooner in the pregnancy. And what I noticed, it was actually the opposite. I didn't notice any pain until late into the game, right before delivery. So around 38, 39 weeks along, I started to notice some discomfort in my symphysis pubis. So it made it a lot more tolerable. I was able to sleep. I was able to roll over in bed. I was able to manage putting on my pants without having excruciating pain. So all this was great. And I was able to stay active throughout my entire pregnancy during that second one. During my third and fourth pregnancies, the pregnancies were a lot better. I had more stabilized hips. I wasn't experiencing the discomfort as often. And when it did come on, I did know exactly what to do with it. And so that really helped to, again, keep me active throughout the entire pregnancy. Plus, I already had two toddlers, so laying around and doing nothing wasn't an option anymore. The other way that I really noticed that pelvic floor PT really helped me out was in my postpartum recovery. Now, I touched a little bit about it already during my first pregnancy and how that felt, experiencing a diastasis recti, and then kind of getting into those exercises. I was really proactive in the exercises that I was doing and how I even carried myself or sat in chairs. What types of exercises was I doing? I really implemented pelvic floor and breathing exercises, especially as the pregnancy progressed. That way, postpartum, I had a quicker recovery and it was a smoother transition into core exercises. I didn't go ahead and jump right in and then have to backtrack to get back to that baseline strength. My goal now is to make sure that I provide education and resources to anyone who has ever felt like the doctor just brushed them off as their symptoms were disregarded. Maybe you're feeling lost. There's a lot of now information on social media, which social media can be great, but at the same time, it can be confusing because there's a lot of different voices telling you of what is correct and incorrect. So just kind of shedding some light on that. If you're feeling lost of where you should even get started postpartum, what exercises are correct for you. If you feel that, hey, I need to be able to know what to do in the delivery room. What happens if I have a vaginal delivery or a cesarean? What are the differences there? And I just want everyone to feel empowered, to feel educated, knowledgeable, so that they can be their own voice, because at the end of the day, you know what's best for your body. You know your body better than anybody else.